as a babe. It is on as a babe, beautiful people all over the world on Freedom Square News. You are welcome on board. And it is on Health Talks, where we inform you, we educate you, that you may live healthy. We need you. Your life is very important. And that is why we are here today. And we are privileged to have Ichie Dr. Bun Eze, Chief Medical Director, St. Sylvester Multi-Specialist Urologist Hospital, Nsukka, and Chief Consultant and Head of Urologist Division, Parkland, Enugu, Nigeria. Doc, you are welcome on board.
Thank you for having me.
Thank you, Doc.
Thank you.
A word to our viewers.
Thank you for following up this program. I want to believe that following us, that we will always have one or two things to learn that will help improve your health. Thank you.
All right, beautiful people, remember, your contribution is very important. You can ask questions as we tally along. You can make your views known, and you can also make suggestions. Remember, it is all about saving lives. All right, today we want to talk on infertility. Infertility. Sincerely, I know the jokes. I know from in-laws, from friends, when they see my wife looking good, they will begin to tell her, how many months are we to wait? Mama, this, that. So from my own experience, I don't even wish my enemy not to be fruitful in marriage. And that is our burden today. If you are in that position, this is for you. So you can do it to share. Who knows? You may just be helping a brother or a sister. Like I said, the topic of the day is infertility. Doc, please, what is infertility?
Infertility is a couple diagnosis. Like it applies to the couple. No single person should actually stand alone and say I'm infertile. Infertility, if you just put it in a straightforward manner, is the inability of a couple to achieve conception, that is to achieve pregnancy, after up to a year of one regular unprotected intercourse that is geared towards conception. I identify by myself as an expert. Somebody can be married for 20 years but doesn't want kids. Might be taking measures to prevent fertility or conception. You can't say the person is infertile. When somebody comes with the fact that, see, we've been married for up to a year, we've been having regular intercourse without any form of protection or any other measure that is geared towards preventing conception, and we've been together for a reasonable amount of time, at least up to a year, that's the only time can you say that this couple have a fertility issue.
Okay. All right, thank you, Doc. Because, the myths surrounding giving birth and all that, in the course of us handling occasions as master of ceremonies, we make a lot of jokes. But sometimes we see reality in it. So there are a lot of myths. Some people will tell you, the man have watery sperm, the woman did this. So at least we have a clear understanding of what we have as infertility. All right, Doc, what causes infertility in woman? Let's start with the woman.
Let's not separate the couple. Because what God has done together, whether in the social perspective or in the altar or to just agree to be together, nobody should actually interfere Not about putting asunder.
Correct.
The fact is that human fertility is a complex thing. Why is so? Is that we're talking about making new human beings. It might not be as straightforward as human beings want it. Because at the end of it all, human fertility, as we said, has a lot of different domains surrounding it. It has the physical domain, it has the social domain, the fact that when, at least in our culture, when somebody gets married, the next thing everybody is praying for is for twins, triplets, and the rest of them. So they're going to ask themselves, these two individuals, have they agreed they want to procreate? You get what I'm trying to say? So it also has some form of social domain to it. The psychological domain of it, of like, I want to have a kid, I can't have it, is the issue. But you want to talk about causes of infertility. About half of the causes of infertility is a couple thing. The man is contributing a factor, the woman is contributing a factor. In such things, we have the man has his own problem, the woman has his own problem. But the problem we have is that everybody believes, because it's the woman that carries the pregnancy, that if she's not conceived, it's her fault. Just as you say, she has just decided not to carry a baby. The mother-in-law will be shouting, I want to have my grandchildren, as if it's the woman that is holding the grandchildren from coming. Here's what I'm trying to make. The point is that we really need to make everybody understand that in about half of cases of inability to conceive, both the man and the woman has done their own individual problems. 25% of them, it might be only the man that has a problem. In the remaining 25%, it might be the woman that has a problem. It's not as easy as saying for the man and for the woman. It's can actually be for greater percentage. Both the man and the woman has got problems. So before you start blaming the woman, she doesn't want to get pregnant, just know that it's just only 1/4 of the cases that the reason for not achieving conception is entirely the woman's problem.
So the first thing is, once you stay for a long time
and you are available lecture, you are willing, and you are doing what people that want to give birth are doing,
you are having,
and the baby is not coming,
you are having intercourse
regular and unprotected.
Okay, very good, very important, very important. All right, so during diagnosis,
yes,
what may be the causes? Because we see some people, they will see people smoking, they will tell them that smoking causes infertility. And also we have seen smokers who gave birth and they were begging them to stop giving birth. Then people will tell you, stop drinking. So some people will stop drinking immediately they get married, or in the time they want their wife to conceive, they stop drinking. Some will stop smoking and all that and all that. So we are confused. And some people will say it can be genetical, hereditary, and so on and so forth. Some people say it might be artificial. Maybe the girl has tampered with her womb, or maybe she took much number of concentrative drugs and it has piled up. And a lot of, some people will tell you it is spiritual problem. She has a spiritual husband and a lot of things. So what and what in diagnosis?
For every health condition, there is always the needs, and there must always be the established facts, the truth. The truth remains that causes of infertility for both the man and the woman can either be congenital or acquired. By congenital, I mean that by the time of conception, there are some malformations or some hereditary factors, as you want to say, that makes it difficult for the person to conceive. We all know those things. Like chromosomal abnormalities in men that alters the structure, genetic makeup of the individual, like nephrital syndrome, let me not speak so much graph, and other ones can actually make it difficult for the man to get a lady pregnant. That's what we call congenital absence of the vas difference. In this situation, the sperm is in the testis process, but the pipe that's supposed to carry it from there to the woman's body is non-existent. There is also a congenital obstruction of the ejaculatory duct. Like a man ejaculates, there is no single sperm in it you go to see. But the opening that is supposed to, the door is supposed to use to enter to the urethra, where if you come out and enter the woman's body is locked. So just know that the causes can either congenital or acquired for both man and woman.
Okay, congenital
And acquired. So congenital is what you are born with. You are born with, can't change it. Acquired conditions are things that you come in contact with after birth. Like when you talk about the issue of lifestyle and the rest of them, the way it affects fertility. Yes, lifestyle affects everything we do that concerns health, including fertility. So smoking on this one can affect how well or how fast sperm beats to hit the egg to achieve fertilization. So at the end of it all, anything that will prevent a viable sperm from meeting a viable egg can cause infertility. Then, be that as it may be, it's important to mention that some causes of infertility are not known. Idiopathic causes, you check everything appears to be normal, but then still no conception. In such cases, you might get to the point where the man gets angry, moves on, or the woman gets angry, moves on her own way. Then the man remarries or gets a different spouse, even if he's not married, and the lady conceives. The problem is when the sperm tries to liquefy, because what we call sperm we see is not actually the sperm cells. Is seminal fluid in which the sperm cells are suspended in. Those sperm cells are like tadpoles. That's how they look under the microscope. They swim. So if a man ejaculates, actually after a time, the coagulation that is seen that is strong, the coagulation should liquefy to enable the sperm cells to swim to hit the target. What I know is that there are parameters to check in the sperm. One is the number of spermatozoa enough. Two is the way they look, the shape enough. There are some that looks like masquerade, they can't achieve conception. There are some that look normal, like tadpoles, I say they will achieve conception. Then the speed with which the sperm moves to be able to hit the target. If it is moving too slow, it's also a problem. The count is enough. It can't penetrate an egg. It needs speed to penetrate, just like a bullet. You know what I'm saying?
Okay, so the speed is it engineered by the man? You know, some people say hit harder.
No, it's not a question of engineering. No matter how hard you hit, where you deposit it is in the vagina. When the thing now liquefies or becomes water, as you say, the tadpole can now swim. It is speed with the tadpole. The sperm is swimming to meet the egg that we are talking about.
So in that case, the woman determines the speed now.
No, this speed is built into the sperm.
Oh.
Produced by the man. If the man produces sperm that don't move fast, nothing will happen. You get the point?
Yes.
So if a man has a sperm abnormality, what you should be considering is one. The abnormality might either be basically one in the number of sperm is produced.
Yes.
So we can have something we call a low sperm count.
Okay.
Or some people will even ejaculate. No sperm is in it as dysphagia. It's getting more common. I don't know why. You see a fine young man, sperm analysis, sperm count zero. That means there is nothing there. So it could be one of the problems. Two, might be the shape. Like I said, normal sperm should be shaped like a tadpole. A tadpole has a pointed end.
Yes.
That when it now hits the egg, it can penetrate. And by the focal level I'm talking about. But if the head is deformed, that's it won't happen. You get what I'm saying? So it might be a problem in number of sperm, shape of sperm, or speed with which it moves. You can have up to 200 million sperm, but all of them are moving like wall cake. You can't score. We call it astenospermia. That's sperm decay one. You can't hit the target with force. So the force is not the force with which the man is hitting the bull's eye.
Alright.
It's the force with which what the deposit will move to meet the egg to achieve fertilization.
And it depends on the healthy nature of
Of the sperm, not on how hard. Whether they will say, has no role to play.
as a Ebe.
Freedom Square.